Welcome back. My next guest is Ms. Shannon Riddle, our Population Health Manager at Family Practice Associate, and she's brought with her a patient, Mr. Jim Hanges, who's a patient with Family Practice Associates. Now, I said CCM, so what is CCM? What's the initial stand for?
CCM stands for Chronic Care Management. It's a program offered at Family Practice Associates of Lexington that involves contacting patients at least once a month by one of our care coordinators. And they work very closely with the providers there at the office to focus on chronic care issues. You know, our ultimate goal is to keep patients healthier longer, improving their outcomes, and reducing the cost of care. The areas we focus on with the patients is creating care plans and goals, making sure that they're taking their medications correctly, making sure they're doing their preventive exams, keeping their follow-up appointments. We coordinate with specialists and pharmacists and accessing community resources when needed. Patients really are truly enjoying it and getting involved in their health care.
Now, you brought a patient with you, Mr. Hanges, who's a family practice patient out there. You participated in the program. Tell me a little about what you think.
Well, I think it's a lifesaver. I really do. Kim, who is my floor plan, she tells me what to do, how to do it, and corrects me and hits my hand when I make a mistake.
Well, they helped you with your diabetes management.
Right. The one thing I never wanted to hear was you're a diabetic. My mother was a diabetic. I'm the youngest of 6 children, and I'm the only diabetic in the family, thank God.
So tell me how they made your diabetes better. What is it that they did that made you a better patient?
Well, she told me that I had a 12, almost a 13 A1C, and I thought that was really good.
Surprise.
Yeah. She said, no, it's not. Let's try to get it down to 9, and we'll chew on it as we go along, and try to get it to where it belongs, 5 or 6. And how well she did? Well, the next time I had my A1C checked, it was 6.
Well, there you go. That's where you want to be.
She just did a fabulous job. And she said, I want to thank you. And I said, no, you did all the work. Because I didn't understand diabetes. I knew I had it, and I knew I had to take shots. And of course, when I came to you, the first thing I did was I complained about the cost. The cost, it was costing me $400 a month to take shots. And you said, well, that's not acceptable. And so we got it down to about $40, $47, I think, a month.
So Shannon, tell me some things you do to help the patients manage their diseases.
So when we contact the patient, sometimes they don't feel like telling the provider everything. They're more open with us as care coordinators when we talk to the patient. And sometimes they tell you that they're taking their medication when they're not. And then they confess that, they can't afford their medicine. So then that becomes the relationship that we talk to the providers, their provider at the office, and see what we can do to lower that or get them into a program that can cost them less money for that medication. Then they're more compliant with their medicine, which improves their outcome with their diabetes or any other chronic disease state.
Yeah, when you mention diabetes, not just diabetes. Tell us about some things that you do other than just diabetes.
Asthma, COPD, hypertension, high cholesterol. It's helping patients monitor their diet and having a better outcome. And just encouraging patients to even a small goal of walking to their mailbox once a day for 3 days a week. Small baby steps to get their heart moving and having a healthier lifestyle makes a difference. And then encouraging them the next week, okay, let's walk down to the end of the street and back, 3 times a week. And it makes them improve their health quite a bit.
Now, this program, you don't necessarily see the doctor in this program. It's pretty much accomplished with the nurse managers.
Yes, the CCM visit is outside of a regular visit. And we see them, or we contact them sometimes twice a month, sometimes more, depending on the need of the patient. It is totally done outside of a regular office visit.
Did you think that was helpful for them to contact you and keep you on task?
Well, like I said, I think it was a lifesaver because I didn't understand what I had, really. And she did. She just guided me through it. She gave me a floor plan to go by and checked on it. And she asked me about my weight, and I told her I was drinking a lot of beer and eating a lot of ice cream, and I couldn't lose any weight. And she said, no, dummy, this is what you do. She didn't say dummy, but she nailed me to the floor. And I respect her, and she's wonderful.
Well, that's great information on.